Batisi TV Lone Rashapi Daka Frank Motors Ka Jaka Dekali Gabatamai Junka Tata Motors Halatko Ni Shillong Ringkat Bakanet Foodish Ordar Mapi Ninwan Ramani Hakirdob Ying Jompi
The Global Alliance for Vaccines and Immunization kabadai ka kinhon kabajupet bat khmi ban Pynïoh ya ka Injek Tika nagabenta ki Khunlung ha ki ri ki bakham duna ka yo ka kot ha ka hanreu tarik ubna ya yong arajar arpuar kala penlong ni ka jingya theria tai hanong ba shalom Lingba ka thong ka Global Alliance for Vaccines and Immunization kalabo thong ban Pynïoh Injek Tika shabaro ki Khunlung nado mentau snem arajar arpuar hado snem arajar arpu hunreu sha ki shnong ki bakham jinjar ka lait kawan ha ka baki kime ki pa ki kham shem shitom ban dait ra ya ki Khunlung ha ki Jaka ajing sumar ban Pynïoh ya ki Injek Tika ka ban yada ya ka jing em jong ki Khunlung Hagani ka jingya theria tai ka balalong ha shlong club bala penlong ka National Health Mission Meghalaya haringkat ka jingya trailang bat ka UNDP Meghalaya ka UNICEF ka WHO ka JSI bat ka JHPIE GO laya simbenta da kinong mi kmat na ki South li ki jilla ki bakin top ya ka jilla Meghalaya ka jilla Mizoram ka jilla Arunachal Pradesh bat ka jilla Nagaland Yakani ka jingya thernia ka balalong hagani ka sngi la plepaj ba da mission director jong ka National Health Mission Meghalaya Ram Kumar ubalalong kumukongsan hagani ka sngi
So this consultation process is designed with the objective of trying to get the contextualization and the root causes to challenges and barriers to reaching children with immunization in different parts of the country. And Gavi Alliance has a board-approved strategy for the next 5 years, and we're trying to get consultations with the districts and states where we will be making investments to be able to overcome those barriers and reach and reduce zero-dose children. So the idea is that we want to do things a bit differently and try to really get the context and richness of having discussions at lower levels where the implementation is taking place and where the localized players and health authorities can really give us the exact details of what exactly they need to overcome to reach those children, because it's very contextualized and specific to different places of the country. And within the northeastern states, what we're doing is having these discussions with 4 of the states to really try to have a much more robust planning process to invest in certain of the areas and be able to overcome those barriers in conjunction with other support that the state will get from the ministry and their own domestic budgets.
We are very happy that today we are having this workshop, which has been organized by the Ministry of Health and Family Welfare, along with Gavi, that is the Global Alliance for Vaccination and Immunization, which has assisted our country in the field of immunization. And now when they are continuing with their partnership with us, they have come to our state and we are hosting Gavi along with 4 other northeastern states of this country. And we hope that today we will be able to brainstorm and come up with new strategies whereby we will be able to improve our vaccination, especially for children who are very prone and susceptible to vaccine preventable diseases, and thereby we can decrease the load of disease burden among our children.
Well, it is a privilege to be here in Shillong, capital of Meghalaya, and it is such a good opportunity because this is the first time Gavi is taking the initiative of coming down to, and we expect that whatever needs we put up, they will take it to the ministry and it will be addressed and it will flow down to the states. It should help us because we have so many deficiencies rather. Nagaland is the poorest in full immunization coverage right now. So we will be putting up our operational gaps to them, and I'm sure they will take our problems to the ministry and it will help us abundantly.
Yeah, immunization status as last year's ROP, it was more than 90% of fully immunized children is more than 90% in the state of Mizoram. Yes, I'm quite happy that Gavi has taken initiative to come to northeast part of India, specifically Shillong, to interact with other northeastern states. So Gavi and India has had an alliance for the last so many years, which was supposed to end in December 2021. But Gavi has decided that due to large gaps in immunization still existing in parts of India, so they have decided that this Gavi-India alliance will continue for another 5 years in selected areas, trying to mainly focus on zero-dose children who has not received any immunization. So they are focusing on northeastern part of India as well, which is very, very welcome. They are here to listen to our problems, to listen to our challenges, and they are here to listen to the suggestions that the northeastern states are making, so that this Gavi India alliance for the next 5 years in trying to improve immunization in the northeastern part of India really works and to a higher new level. So I'm very happy that Shillong, Meghalaya has decided to convene this meeting for other parts of Northeast India. Shillong is hosting it. I'm very grateful to them, and I'm grateful to Gavi officials to have come all the way to Shillong to interact with us, to listen to us, and so that we can have a meaningful 5-year relationship in the next 5 years.